Dania Blanco, and this is my presentation on diabetes. Diabetes mellitus. So, diabetes mellitus, also known as DM, is a health condition that occurs when your body does not make enough insulin or cannot use it as it should. Diabetes increases the risk of early death, and diabetes related complications can lower quality of life. Of the three different types of DM, which include diabetes type 1, type 2, and gestational diabetes, about 90% to 95% of people with diabetes have type 2. Populations impacted. So, type 2 diabetes is a largely diet related and develops over time. Again, this is the most common diabetes that affects most people, but diabetes 2 affects mostly people from racial and ethnic minority communities. Majority of California adults have pre-diabetes or diabetes, and a third of young adults are pre-diabetic. Potential consequences. So, more than 30 million people in the United States have diabetes, and it's also the seventh leading cause of death, according to Healthy People 2030. Poorly controlled or untreated diabetes can lead to leg or foot amputations, visual loss, and kidney damage. Other consequences can include increase of stroke and increase the risk of heart attacks. Preventions. A healthy diet, regular physical activity, and maintaining a normal body weight and avoiding tobacco use are just several ways to prevent or delay the onset of type 2 diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, and regular screenings and treatment for complications. Care coordination. People with diabetes have medical expenses approximately 2.3 times higher than those who do not have diabetes. Total direct medical expenses for diagnosed diabetes in California were estimated at $27 billion in 2017. With the transformation of the healthcare system well underway, care coordination is now being highlighted by hospitals, health systems, and insurance as a key tool in improving patient health and satisfaction and controlling healthcare costs. Support. So this can help with prevent or delay diabetes complications. It can also improve overall health outcomes, and can help these individuals join in evidence-based lifestyles that are proven to help and cope with a change in their lifestyles. The nurse's role. Nurses can use critical clinical judgment skills to help the medical team address patient-centered health goals, identify and address social determinants of health, and also health literacy issues, as well as support the medical treatment plan. So on the image on the right is just a couple of healthcare team members that are a part of patient with diabetes healthcare team. So a few to name are diabetes educators, eye doctors, as well as dentists, pharmacists, just to make sure that these individuals are being well taken care of and are able to manage their signs and symptoms. The nurse provides holistic care to their patients, including their psychosocial, developmental, cultural, and spiritual needs. These are all parts of what the nurse roles includes. Basically, what this means is that the nurse focus is on the patient's education and prevention, not only solely providing skilled care to the patients. So, in summary, diabetes is the seventh leading cause of death, according to Healthy People 2030. Evidence has shown that people with prediabetes who finish structural lifestyle change programs have a lower risk of developing diabetes. According to Healthy People 2030, only 51% of adults 18 or older with diabetes receive formal diabetes self-management, education, and support. So, in summary, there is no cure for diabetes, but it can be managed. Educational and prevention should be based mainly on nutrition, exercise, and disease process, but also include education on regular doctor visits, including ophthalmologists and foot care. The nurse's role is to educate the patient on making sure they're daily doing blood sugar checks, as well as adhering to their medication, and help patients reduce the risks of the consequences that patients with diabetes can experience. So, providing education on healthy eating, keeping track of their carbohydrates or calories, encouraging exercising, and also managing their stress are all key factors that should be educated to the public. And these are my references. Thank you.